Depression is a mental health mood disorder characterized by persistently depressed moods or loss of interest in activities and causes significant impairment in daily life. Possible causes of depression can be a combination of biological, psychological, and social sources of distress. Scientists believe that 40% of those with depression can trace it to a genetic link, but environmental and other factors make up for the other 60% of those affected with depression. Physical changes or chemical imbalances in the brain may contribute to the development of depression. Also, hormonal changes, trauma or stress, personality traits such as having low self-esteem or being pessimistic may increase your risks of having depression. Other mental or physical illnesses or conditions or taking certain medications can increase the risk of depression also. Depression affects the way the brain functions, including altered activity in certain parts of the brain. The amygdala, the thalamus, and the hippocampus play a significant role in depression. There's an influx of cortisol that is triggered by depression, which causes the amygdala to enlarge. When the amygdala enlarges and becomes more active, it causes sleep disturbances, changes in activity level, and changes in our hormones, which are three of the top symptoms of depression. So sleep disturbances, continuous low mood or sadness, feeling hopeless or helpless, feeling guilt-ridden, feeling irritable and intolerant of others, having no motivation or interest in things, finding it difficult to make decisions, not getting any enjoyment out of life or out of things that once brought you joy, feeling anxious or worried, or having suicidal thoughts or thoughts of harming yourself are all symptoms of depression. When medications called SSRIs, which are selective serotonin reuptake inhibitors, which are the first line of defense for treatment of depression, or MAOIs, which are monoamine oxidase inhibitors, which is an older type of antidepressant but is still used today, and therapy are not effective. Other options doctors may suggest are ECT therapy, which is electroconvulsive therapy, transcranial magnetic stimulation, or vagus nerve stimulation. There are different types of depression. Major depression, persistent depressive disorder, bipolar disorder, seasonal affective disorder, known as SAD, psychotic depression, peripartum depression, which is postpartum depression, or PPD, premenstrual dysphoric disorder, and situational depression. There is a huge stigma about mental health and depression, but I do feel like in the recent years, with the rise in popularity of social media, although some may say social media has added to depressive symptoms, especially in teens because of online bullying, etc., there are a lot of people who do use social media as an outlet to talk about mental health and to show people that they are not alone, and that being depressed or having anxiety or having bipolar disorder, etc., is all pretty common. 16.2 million adults were diagnosed with depression in 2019, and I am positive that number has climbed significantly in the wake of this global health pandemic, with people isolating themselves from their loved ones, having to stay home, losing their job, or working their job from home and having to juggle work and helping their children with virtual school, etc. This past year has been quite bad for the world as a whole, and according to one small study, 29% of the people who took the survey responded that they were severely depressed, compared to just 9% before the pandemic started. Depression can't be cured. Cured means gone forever, but it can be treated with medications like the SSRIs I mentioned, or the MAOIs, or the ECT therapy, or the transcranial magnetic stimulation, or the vagus nerve stimulation. They've even approved medical marijuana for the treatment of depression. A variation of these things, along with lifestyle changes, even just exercising regularly and eating a balanced diet, can significantly help with depression symptoms. There is help out there: therapy, support groups, multiple phone hotlines. Depression is something that you don't have to deal with alone. And although one may feel hopeless, there is hope to living a fulfilling life, even with depression. And that is my oral presentation. Thank you.